So now let's move on to the genitourinary system, or you can just say nephrology section. Here we have a mnemonic, and that is find lime and hippo on a bloody polyuric fun ship. So what does that stand for? Well, glad you asked. F for fits, I for itch, and for nausea and vomiting, D for dyspnea. Lime stands for libido, impotence, metallic taste, and edema. Then we have hippo, which stands for hematuria, incontinency, pain in lumbar region, and just proteinuria. It's fine lime and hippo on bloody polyuric funship. Now, what is bloody? It stands for bleeding tendency. Polyuric, we have to ask about the polyuria. Now, what are the other extensive questions for the polyuria? It's funship. Now, this funship stands for frequency, urgency, nocturia, stream, hesitancy, intermittency, and post-void satisfaction. So these are the all complaints of genitourinary system. We're going to discuss this all in detail in our genitourinary section. So let's draw our scene. We have a large fun shape, and on that shape we have kids enjoying with the lime, and beside that we got a hippo. Okay, so now what? Is that all? Well, wait for a second. There's always more to show up. To tell you about fits, we're going to draw this epileptic man who is just having seizures underneath the ship or fun ship or something. Uh, I don't know. Anyway, we're having a man who is just having an attack of seizures. And to talk about seizures, we can always have a long duration since childhood or a recent onset. If it's from childhood, it's idiopathic epilepsy. And if it starts after the age of 30, that's because of symptomatic epilepsy. It can be because of space-occupying lesion, for example, tumor, abscess, hematoma, etc. Then you're going to ask about the frequency of fits. How many episodes do they get in one day? Now, the fits of the genitourinary system are somewhat different from the fits of the CNS system. Now, in CNS, you get a long list of seizures. They could be focal seizures, they could be with or without impairment of consciousness, could be generalized seizures, including absence seizures, tonic-clonic seizures, tonic, atonic, myoclonic, or just epileptic spasm. However, the seizures of genitourinary system are somewhat different. They are because of uremia. So here we're just going to learn about the associated symptoms, and we're going to discuss these seizures in detail in CNS section. First things first, as I said earlier, ask about the duration and onset. So this board from morning to evening is going to tell you about duration and onset. Next, what is that? It looks like CD or compact disc or DVD to me. Maybe some DVD in which he has stored some of his memories. So this DVD is going to tell you about the memory for the fits. Now, if a patient has fits, ask about the memory for the fits. If there's no memory for the fit, and the patient himself is not able to describe the fits, that is because of organic fits due to epilepsy. However, if the patient remembers everything about the fits, it's just hysterical fits. Then we draw some rash on our epileptic man. The rash on the face with the fits is going to tell you about Sturge-Weber syndrome or just tuberous sclerosis. Now we draw the disabled friends of this epileptic man who are just on wheelchairs, who have come along with him to enjoy this funship show. One thing you're surely going to notice is that the friend on the left side is actually paralyzed. He can't move his hands or feet, while the friend on the right wheelchair is absolutely fine. Actually, it's not friend, it's girlfriend. Anyway, you're going to see a lot of frogs or toads or whatever these are. I'm just calling them toads. You're going to see a lot of toads beside the paralyzed man in the wheelchair, and these toads are there to remind you of Todd's paralysis. So, a patient with epilepsy must ask about transient paralysis or just Todd's paralysis, and this could be because of temporal lobe epilepsy, which is related to CNS cause. Next up, the girl on the wheelchair. She is with the flame bandana, all time fully active, all ready to give headache to the other boy. So to give headache to the other boy, we're just giving him a headache cap. A girl with a flame bandana, highly active, and a boy with a headache cap. Sick of this girl's girlish talk. So sick that he eventually got paralyzed. This girl has not only given him headache, but she's also giving him anxiety and depression. That's what girls are for. Women. Anyway, just as refresher, when you're dealing with fits, ask about time, memory, fever, headache, paralysis, or just Todd's paralysis, anxiety, or rash. Next, we draw another next complaint, and that is itch. Now, this itch is actually a topic for the dermatology section, but just keep in mind that a patient with a chronic renal disease can also present with a severe itch. And that's actually a very common presentation of CKD. Okay, so next up, we're going to ask about nausea and vomiting. So we're going to represent this by a kid in the fun shape who is just nauseating. To learn more about nausea, you can always go to our GI section where our advocate Jamal Pandu was shot dead beside stool. By whom? By a weird machine. And if you just look at the second terminal of that machine, you're going to find a lot of causes of the vomiting. Next, what we have here in the funship zone is a pod. And this part is going to tell you about PND, orthopnea, and dyspnea. Now, this is also related with CKD. In the CKD, you get fluid accumulation. In nephrotic syndrome, you get fluid overload in your body, and you can present with shortness of breath. To learn more about dyspnea, you can always go to our combined cardiology and respiratory section. The very same section where the prince of all sins got his horse beaten by a low-class warrior. Yes, sure. So that's enough talk about fates, itch, nausea, vomiting, and dyspnea. Let's talk about Lyme. Lyme stands for libido, impotence, metallic taste, and edema. So first, if we talk about libido and impotence, we draw a kid here who is playing with a sword. What? No, I don't think it's a sword. I think it's a weapon. And this weapon is not meant for kids because kids cannot have this weapon. Or if they have, it's just useless, like libido. Hey, listen, kid, you can't use this weapon right now. You're too young. This won't get straight. All you have to do is wait for your adolescence, really. So, okay, back to the lecture. So there's loss of libido sword or something like that, or we can say floppy sword, is going to represent the loss of libido and impotence. Now, the libido is really lost in DCLD, diabetes, thyroid diseases, anxiety, depression, and through certain drugs, for example, spironolactones. And just to help you remind all these causes, we're going to draw the cirrhotic liver tree along with both the thyroid diseases and a sugar candy jar and some drugs. And you know what? This kid is trying very hard to straighten this floppy sword, and this is going to give him anxiety or depression. Bro, you're too young to take anxiety and depression for this. All you have to do is wait for the right time, and things are going to straight up on their own, just like this sword. Okay, so let's continue our lecture and ignore that kid. What about the metallic taste? Yes, it's very common in the patient with chronic renal failure. So for this, we're going to draw these falling metal nails. All you have to do is ask the patient if they feel some metallic taste in their mouth. If they say yes, that's the patient of chronic renal failure. Looks like this huge fun ship swing is going to get down soon. You're all going to die, kids. Okay, so another complaint about the genitourinary system is edema. So we share some of the water from this animator's water tank into our own funship scene. And to learn more about edema, head over to our cardiology section to learn more in detail about this animator's edema water tank. Now that really sums up Lyme, which is libido, impotence, metallic taste, and edema. Now let's move on to hippo, shall we? Look who's standing beside this hippo. It's a girl, and she's having some pain in lumbar region. Now there are different causes for the pain in lumbar region. It could be because of ureteric colic due to obstruction by a stone, crystal, or clot. Could be UTI, could be glomerulonephritis, or just enlarged kidneys, as seen in hydronephrosis, polycystic kidney disease, or just the tumors of kidney. So when a patient complains of pain in lumbar region, all you have to do is ask for onset, duration, intensity, progression, associated factors, relieving factors, aggravating factors, character, radiation, periodicity, and a lot of these details. If the pain is unilateral, that's because of colic or hydronephrosis or tumor. If it's bilateral, it's most likely going to be polycystic kidney disease or UTIs or just glomerulonephritis. If the pain is colicky, that is because of ureteric colic. If it's dull, it's UTI or hydronephrosis or polycystic kidney disease. It can also be acute glomerulonephritis. When asked about the severity of the pain, radiation, now if it's radiate towards the groin region, that's colic. Or if it's localized to the lumbar region, that's seen in all other conditions except colic. Now, if we talk about the associated symptoms of pain in lumbar region, first of all, we get this arthritis or joint pain and swelling. Now, if there's pain in lumbar region along with joint pain and swelling, that could be because of gout or just Neisseria goodneri. Next, we're going to draw as, which is going to represent mass. Mass, mass. Anyway, this donkey is with fever. So if there's a mass with a pain in lumbar region, that's because of hydronephrosis, polycystic kidney disease, or just renal tumors. And if there's fever with the pain in lumbar region, that is because of pyelonephritis or renal TB. Behind this mass is a kid who is urinating lava, a burning flamey urine. What? Now this is really giving me chills back in my spine. Ooh, painful. Anyway, so this boy with flamey urine is going to represent dysuria. So if there is dysuria along with pain in lumbar region, that is because of UTIs. Now we're going to draw many kids who are just urinating around. Now these are many kids, or you can say poly kids, and they are doing what? Polyuria. Yes, these many kids are going to represent the polyuria, and we'll come back to this polyuria again right after we discuss hematuria. And guess what? What else can be a good place to describe a hematuria besides hippo? So the girl sitting on the hippo just peed there and there's blood everywhere. Now the blood in urine is just called hematuria. Now we're done with the pain in lumbar region. To summarize, we can always ask dysuria, polyuria, fever, hematuria, joint pain, or just mass in the lumbar region. Now let's talk about hematuria. It's just the blood in the urine. Now, hematuria can be gross or microscopic, but only gross hematuria can be diagnosed with the history. Just as a pro tip, remember not every red urine is hematuria. It can also be hemoglobinuria, myoglobinuria, porphyria, or some drugs, for example, rifampicin. Now, the hematuria has a lot of causes, for example, renal diseases, renal stones, pyelonephritis, IgA nephropathy, also known as Burgess disease, tuberculosis, or in the diseases of bladder, for example, cystitis, calculus infection in bladder, or just vesicle tumors, urethritis, prostatitis, or just bleeding diathesis, for example, thrombocytopenic purpura, or just anticoagulation therapy. Now you'll ask about the duration of hematuria. If it's short, it could be cystitis, pyelonephritis, renal or vesicle tumors, or just renal trauma and infarction. If the duration is long, it is because of renal calculi, or just calculi in the bladder, or just benign recurrent hematuria. If the onset is sudden, it's just renal or bladder tumors or renal trauma. If it's gradual, it could be cystitis or pyelonephritis. If it comes in attacks, that's because of renal calculi or the stone in bladder or just IgA nephropathy. One very important question to ask is the pain. Is it painful or painless? If it's painless, that's because of tumors, polycystic kidney disease, or just bleeding disorders or benign recurrent hematuria. If it's painful, that is because cystitis, pyelonephritis, renal stones, or stones in bladder, or urethritis, prostatitis, or just renal infarction. Another important aspect is to ask about timing. If the hematuria is the beginning of micturition, this is urethritis. If it's at the end of micturition, this is cystitis or prostatitis. If it's uniformly throughout the micturition, that's seen in all renal diseases and bleeding disorders. And finally, if it gets bad with dehydration, that's because of renal stones or stones in bladder or just UTI. And if it gets bad with exercise, this is IgA nephropathy. Now, if we really talk about the associated symptoms, first of all, we get a discharge, and this is called urethral discharge. Now, if there's discharge and hematuria, that's because of gonococcal or non-gonococcal urethritis. So, to tell you about this discharge, we draw this sticky discharge underneath that hippo. Next, you'll notice some red particles that suspiciously look like RBCs. So, you're going to ask about the symptoms of anemia. So in a patient with hematuria, ask about the symptoms of anemia, for example, pallor, palpitation, fatigability, myalgias, breathlessness, dizziness, palpitations, and so and so. And besides this discharge, bleed, and anemia, other features which are associated with hematuria are fever, pain in lumbar region, mass, and dysuria. And we're really not going to draw this whole, we're just going to share these features. For example, we're going to share this donkey with the flame bandana, that girl with the pain in lumbar region, and the flamey boy with the flamey urine representing dysuria. We'll just share it with the hippo. Now, if there's fever with the hematuria, that's because of pyelonephritis, renal TB, or because of renal tumor. If there's dysuria with the hematuria, That's because of cystitis or just stone in kidney or stone in bladder or urethritis or prostatitis. If there's hematuria along with pain in lumbar region, that's because of stone in kidney or bladder. And finally, we almost forgot about that S. If there's a mass in the lumbar region along with hematuria and that mass is unilateral, that's because of renal tumor. Or if this mass is bilateral, that's because of polycystic kidney disease. Now that was all about hematuria. Just as a recap, in a patient with hematuria, ask about fever, dysuria, discharge, pain, mass in lumbar region, bleeding disorders, bleeding complaints, and anemia. Now let's move over to incontinency. We have another kid who just peed without any reason. Now, that's the actual incontinency. Now, this incontinency is seen in many diseases. For example, in the later stage of diabetes, we get this incontinency in prostate diseases and also in the sphincteral problems. And if there's injury to the spinal segment, we get incontinence. So, ask your patient about incontinency. Also, you're going to ask your patient about froth in their urine. This is going to tell you about proteinuria. And there are many diseases in which you get the proteinuria. For example, nephrotic syndrome, you get proteinuria in the initial stages of CKD, diabetic nephropathy, and so and so. Next, let's go back to our many kids who are just representing this polyuria. Now, if a patient complains of polyuria, you might want to keep many causes under your differentials. And guess what? All these causes are explained by this Psycho's polyuric store. As the name shows, one of the causes for polyuria is psychogenic. It means the patient is just drinking enough water. So to differentiate between psychogenic polydipsia and pathological polydipsia, you're going to ask the patient about nocturia. If they have to wake up at night and go for urination, that's because of pathological. And if they do not wake up at night for urination, that's physiological or psychological polydipsia. Next up, you're going to see a jar of sweet candies. That's going to represent diabetes mellitus. In diabetes, you get the polyuria along with polyphagia and polydipsia. Next, what else is on this Psycho's polyuric store? Well, these are binoculars or just glasses used by spies. So these are spy binoculars, which are technically going to remind you of diabetes insipidus. Spy binoculars for diabetes insipidus. Now, along with polyuria, they're also going to have headache or just visual disturbances. Now, let's see what else can we find on this store. Well, here is a shake with a loopy straw. This straw is in loops. Oh yes, I know. This straw is going to remind you of loop diuretics. So it's very important to review the drug history of a patient with a polyuria. Are they patient of congestive cardiac failure or liver cirrhosis or nephrotic syndrome for which they are taking diuretics? You know, this store is also selling the Calci Yum ice cream. So let's add the banner of calci, yum. To remind you of that, the hypercalcemia is also a cause of polyuria. Now, in a patient with hypercalcemia, they're going to complain polyuria along with anorexia, nausea, vomiting, constipation, and bone pains. Next up, we're going to add this injured hanging kidney. That is going to remind you of chronic renal failure. Now, if a patient of chronic renal failure comes with polyuria, you're going to ask about anorexia, nausea, vomiting, diarrhea, metallic taste in the mouth, hiccups, pallor, or breathlessness. These are all the signs of chronic renal failure. One more thing you're going to notice from these polyuric kids is that one kid is too anxious. I don't know why, but he's anxious because other kids are making fun of that thing. Yeah, that thing. Anyway, we draw a sign of anxiety. Now, if there's anxiety and there's history of palpitation and then polyuria after the palpitation, that is paroxysmal atrial tachy. And finally, to explore this polyuria in more detail, we have this funship, or simply we have this bloody polyuric funship. Now, if we just skip bloody for a moment and focus on the word funship, we're going to see its frequency, urgency, nocturia, stream, hesitancy, intermittency, and post-void satisfaction. You're going to ask your patient how many times do they have to go. This is frequency. This is increased in many diseases as seen in the polyuria. Next, you're going to ask about the urgency. This is going to tell you about incontinency. Then you're going to ask about nocturia to separate the psychogenic polydipsia from the pathological one. Then you're going to ask about the stream. The stream is disturbed in a lot of cases. For example, prostatitis, the stream is disturbed in stricture. It's also disturbed in other surgical causes. And of course, stream is also disturbed in renal stones. Then you're going to ask about hesitancy. Can they easily initiate urination? Then you're going to ask about intermittency. Now, this is seen in prostatitis. And then finally, you're going to ask about post-void satisfaction. Are they satisfied after peeing, or they feel the urge to pee again for the second time? So this funship mnemonic is basically for the BPH, which is benign prostatic hyperplasia. And now let's go back to the bloody part of bloody polyuric funship. Yes, bloody. This bloody stands for bleeding tendency. And to represent this, we're going to draw some pipes, and one of these pipes is red. It means bloody pipe. As you can see, a lot of blood is coming out of these pipes, and this is going to represent the bleeding tendency. One thing that you're going to notice is that there are some red particles that are suspiciously looking like red blood cells, and they're here to tell you of anemia. So in the bleeding disorders, ask about anemia. Now, if we talk about the bleeding disorders, we can have disorders of coagulation, platelets, we can have disorders of both coagulation and bleeding disorders, and vascular defects. Now, this bleeding disorder is seen in chronic kidney disease where the hyperuricemia doesn't allow the platelets to fuse. So, if you see a patient with a bleeding disorder, ask about the age of onset. If it starts from childhood, that's because of hemophilia, thrombocytopenia, Schonlein purpura, or von Willebrand disease. If it's in adults, that's because of aplastic anemia or autoimmune thrombocytopenic purpura, hereditary hemorrhagic telangiectasia, or DIC. If it's in old age, that's the senile purpura. Ask your patient about the site of bleeding. If it bleeds in muscles, joints, and deep tissues, that's because of hemophilia or Christmas disease or just an anticoagulation therapy. If it bleeds superficially, for example, epistaxis, bleeding from gums or mucous membrane or skins or petechiae, that's because of thrombocytic purpura, acute leukemia, von Willebrand disease, thrombocythemia, or just hereditary hemorrhagic telangiectasia. Next, you're going to ask about the type of bleeding. If it's sudden and stops within 48 hours, that's because of thrombotic purpura, von Willebrand disease, or DIC. If it's gradual and does not stop easily, that's because of hemophilia or Christmas disease or anticoagulant therapy. Now, after site and type of bleeding, ask about character of the bleeding. If it's pinpoint, it's petechiae. If it's on buttocks and legs of a children, that's Schonlein purpura. If there are bruises, it's senile purpura. Or you can also have Cushing's under differential. If there's subcutaneous hematoma, that's because of hemophilia or von Willebrand disease. Now let's move on to other associated features with the bleeding tendency. Ask for lymphadenopathy. If there's bleeding tendency along with lymphadenopathy, this is going to be acute or chronic lymphocytic leukemia. What else can you ask your patient? Well, you can always ask about fever. If there's fever and bleeding tendency, this can be aplastic anemia or acute leukemia. Next, we're going to add a pole among these pipes. And on that pole is a red handkerchief hanging around. And this red handkerchief is the recurrent sign for the sore throat. If there's sore throat along with bleeding tendency, that's going to be aplastic anemia. And just before winding up things, if there's joint pain, oliguria, hematuria, and abdominal pain with bleeding tendency, that's Schonlein purpura. And just to summarize the associated features of bleeding tendency, you can always ask about sore throat, fever, lymphadenopathy, joint pains, oliguria, hematuria, abdominal pain, or anemia. And one more thing before we go, just keep DIC in mind. So to remind you of that, we'll draw this big dice. So you just make sure you rule out all the causes of DIC, for example, snake bite, infection, or carcinoma, etc., etc. Now that really concludes our section of history taking about genitourinary symptoms. How about we give it a recap? What do you say? First of all, you're going to ask about fits, itch, nausea, vomiting, and dyspnea. Then you're going to ask about libido, impotence, metallic taste, and edema. Then you're going to ask about hematuria, incontinency, pain, and proteinuria. Then you're going to ask about polyuria and associated features along with extended features of polyuria, which is just funship, frequency, urgency, nocturia, stream, hesitancy, intermittency, and post-void satisfaction. Then you're going to ask about the bleeding disorders. Phew, that's it. That was pretty simple.